Good afternoon, everyone. My name is Steele Forrest. I'm the program manager for the UC San Diego Prepare Institute. For those of you that maybe aren't so familiar with us, we are essentially UC San Diego's Pandemic Preparedness and Response Institute. Fairly new on campus, but we're very mission focused on making sure that we've learned key lessons from our collective COVID experience and that we're prepared for the next emerging infectious disease that may cause social and health disruptions throughout San Diego region and beyond. If you want to know more about the Prepare Institute, please do check out the link that I put in the chat about us. And we're extremely pleased and grateful to welcome Dr. Leslie Lewis today to speak on homelessness as context and mirror for infectious disease pandemics. Dr. Lewis is a continuing lecturer in urban studies and planning, and also the director of education and community engagement at the new homelessness hub at UC San Diego. And additionally, Dr. Lewis is the director of urban health and equity initiatives at the Bioregional Center for Sustainability Science, Planning and Design at UC San Diego. So a little bit more about Dr. Lewis. Dr. Lewis's teaching, research, and community engagement center on health and health equity, environmental and climate justice, systems of inequity, community resilience, housing and homelessness, critical pedagogy, and community-based participatory action research. Her work facilitates connections between academic and community partners and promotes a paradigm for research, action, and learning that is just, collaborative, and mutually beneficial. Dr. Lewis has developed multiple educational and research programs on topics of climate justice and action, healthy aging, homelessness, and healthy placemaking. A Rockwood Leadership Institute graduate, Environmental Leadership Program Senior Fellow, and UC San Diego Changemaker Faculty Fellow, Dr. Lewis has been honored with 18 awards over the past decade for distinguished teaching, student advising, sustainability, and fostering equity, diversity, and inclusion. So with that, Dr. Lewis, I'm happy to turn over the share to you and we can get started.
Okay, thank you. Super awkward listening to somebody talk about you like that. All right, so I'm gonna thank you so much for inviting me and everyone for joining us today. Let's see if we can make this bigger. Let's do it this way. There we go. Okay. All right, so you heard a lot about me. This will maybe be a little, I don't know if you all regularly come to Prepare Institute talks, but so this might be a little unconventional compared to those. I am going to talk about Homelessness Hub, but I'm going to wait till the end because I wanted to start off and just sort of, I'm not sure when I give these kinds of talks, what background knowledge people come with around homelessness, houselessness. So I want to start off and just sort of talk about homelessness as the context. And it is a context for infectious disease pandemics, among other things. It's also the context for our lives. And because we're sort of seeing this as we're out there in the world. So I just kind of want to give a sense of what we're talking about, a sense of maybe the demographics and the scope of it, and then talk about ways that people who are unhoused are particularly vulnerable. This will come as no surprise to you, most of you, for really all kinds of health problems, but certainly communicable diseases, infectious diseases. And then just talk a little bit about the ways that we have sort of shared roots and shared conditions for both homelessness and pandemics. And so, and then I'll go into Homelessness Hub, talk a little bit about what we do. So just some of that background. We have, again, don't know how much of a sense people have of just what level of kind of precarity so many Americans are living in right now. But so housing instability, which is linked to kind of economic insecurity and food insecurity, that's sort of the broader pool of people who are vulnerable. So at the moment, we have 13 million Americans that are behind on rent or mortgages. 11 million renters spend more than 50% of their income on their rent. So millions of people are really sort of at that kind of unstable level. And then a small percentage of those fall into homelessness, and that can be divided into sheltered homelessness and unsheltered homelessness. Sheltered being people who are in emergency shelters, transitional shelters, maybe what they call couch surfing or doubling up with people they know. Unsheltered can be anything from rough sleeping on the street to sleeping in their car, just to anywhere that's sort of unfit for human living. And then there are sort of categories of homelessness. The majority of people who fall into homelessness will actually get themselves out, and we tend to understand them as transitionally homeless. Now, giving them help is a good thing. It reduces suffering, and it can, and if you're picking the right people, then you're possibly, sort of diverting people away from chronic homelessness and episodic homelessness. Chronic is about a third of the people that are out there, and that is folks who have been unhoused for at least a year or multiple periods over the prior few years. So a sense of the scope, the big problems with trying to count these things, as you can imagine. So lots of estimates. We do have a point in time count that all cities are supposed to do, and we certainly do, and you can volunteer for it if you're interested. It's actually I think an important experience to have. Gets you really up and close with it. If you look at something like a point in time count, the numbers across the country, I don't know what it landed at this year. I don't know if they've released the numbers, but it tends to be around 600,000. There are lots of other estimates, though. Generally, the estimate is around 3.5 million people in the US, but even that is probably an underestimate, because you can look at something like, there's some new research that's looking at census data, and just looking at people who are doubling up, they're finding about 3.7 million. And so then you still have to consider all of the other folks who are living on the streets, living in shelters, living in their cars, et cetera. And then you could think also about what is sort of the demographic profile of this? What percentage are families? Those numbers vary across the country. Estimates are from 37 to 41%, depending on what source. California is interesting. We are we have the most unsheltered, unhoused people. We also have 80% of our unhoused folks are adults that are not with children. And then 14% are families with children, 7% are unaccompanied youth. Oh, and just another number here, there's some research out of Chapin Hall out of the University of Chicago, and they looked at just unaccompanied youth homelessness and found 4.2 million unaccompanied youth. And so it just sort of blows the other numbers out of the water. So it's really difficult to know. So these, when you say numbers like 3.5 million, that's surely an undercount. And then kind of narrowing into San Diego, last year's point in time count, we're sort of waiting with bated breath to hear what is it. We think it's gone up. If you just look around, it certainly looks like it's gone up. But last year it came in around 8,400. Yet again, the point in time count is a little snapshot one night of the year. And you could go to nonprofits who are working with people who, unique individuals who are experiencing homelessness. And so if you go to Interfaith Community Services, they report things like, well, we ourselves, just our organization has served 16,000 unique individuals. Family Health Centers of San Diego talks about theirs being 25 to 27,000 unique individuals each year. So that gives a sense. And the National Law Center on Homelessness and Poverty estimates that the actual number is probably 2.5 to 10 times greater than whatever comes up in the point in time count. That tells us that what we're probably dealing with in San Diego is around 80,000 or up to 80,000 people. And contrary to, we have a lot of assumptions about people who are experiencing homelessness, that they are from somewhere else and they're somehow coming here because the weather is so good. The truth is that 80% of the people that we find on the streets and experiencing homelessness are from the San Diego area. And contrary to presumptions that everybody who's unhoused has got some kind of a psychiatric diagnosis, a mental illness, or a substance use disorder, that comprises about a third each. And there is, of course, some dual diagnosis and some crossover in that. And then there's the argument that, or questions about whether those are causal? Do those cause homelessness, or are those things that arise out of the experience of living unhoused? Because it is brutal to be experiencing homelessness. So a little bit more about the demographics. Just lots of different ways to slice and dice it. About 10% of people who are experiencing homelessness are veterans. That is actually an area where a lot of resources and attention have been focused, and there are a few cities across the United States that have actually solved or gotten it to functional zero, as they say. We do have enough resources to do that. Not so in the other areas, and it's still not solved, just to say. Older adults are actually the fastest growing subpopulation of unhoused folks, and that's both because people who are chronically homeless are aging, and so they're getting older, but also, and I've certainly encountered a lot of people in my research, particularly in the safe parking lot programs, so many older adults who are just sort of, I don't know, like economic refugees, and they lose their naturally occurring affordable housing. Something happens in their life, and so lots of those folks as well. And if you bring older adults all the way down to 50 years and up, they make up half of the unhoused population, so it's quite high. I mentioned chronically unhoused folks. It's about a third of the population of people experiencing homelessness. Youth, again, depends a lot on where you're talking about, but put the percentage at about 8%. And then of those youth, 40 to 45% of unhoused youth identify as LGBTQ. So that's a huge factor, particularly for youth. Very bad numbers for that subpopulation among adults, which is too bad. Even college students, and this is sort of this growing realization that people are having, that, college students who people used to assume, okay, well, those are all privileged kids and they're all fine. 5% of UC students across the UCs have experienced homelessness. It's 9 to 10% with the state schools, CSUs, and 20% with the community colleges. So it is huge. And, we have these UQ studies. And so we're, keeping up yearly, asking students about, how often are you are behind in rent? How often are you having to forego eating because you don't have enough money? And those stats are just going up, and they're shocking. We also see, as we see across the country, whenever you have a harm, you have disproportionate harm then by race and ethnicity, which is not a surprise because we are embedded in systemic racism, and of course it intersects with other systems of inequity and oppression. But in homelessness, it is loud and clear among Black, Indigenous, and Pacific Islanders specifically, but also multiracial. You see much higher rates, and disproportionately high compared to their presence in the general population. Hispanic or Latinx, twice the rate of whites, multiracial 3 times, 5 times the rate for Black Americans, 6 times the rate for Native Americans, and Pacific Islanders is particularly shocking. It's like 15, 16 times the rate. And that's just the overall rate. When it comes to families, it is particularly jarring for Black families compared to white families. So Black families stay in shelters at 7 times the rate of white families. So, one of the things that I think is really important for people to understand is that our crisis of mass homelessness, which is really about 4 decades old, starting in the 1980s, it has historical and structural causes, right? It is, it's not that there aren't individual, factors that are at play. It's just that this is this sort of this baseline. And what we're talking about is this, baseline of economic insecurity, economic inequality, which is linked, and a gross lack of housing that's affordable to large swaths of the population. And then, we have conditions that just make it really hard for people to survive. And then the ways they cope maybe are not the greatest, and they don't necessarily, enable them to kind of to succeed. But we also have an overlay of kind of cultural ideologies and narratives that that blame individuals, that lift up, meritocracy and individualism and all of these things, pull yourself up by your bootstraps. And so it is people out on the streets experience tremendous stigma. It's something that comes up again and again when I'm talking with them. Almost more than any other thing, they just want to not be, regarded in such negative ways and treated so negatively. And this is, again, I don't know what you know about, our sort of the state of our nation, but we have quite high rates of poverty in the US, up to about 14.4% of our population in 2022. Living at or below the federal poverty line. And the problem is that's already shocking, but the federal poverty line doesn't begin to capture, economic insecurity. I mean, you can double or triple that and still find that people are just living so close to the bone and they can barely make it. We are, when you look at our peer nations, I mean, our poverty rates are just really shocking. And again, this is like OECD, other countries that are supposed to be, industrialized, democratic, wealthy nations like we are. We're very wealthy overall, but we have a shocking percentage of our population living in poverty. And then again, when you think about when you use a different measure that's more accurate in terms of what people need to just survive, particularly when you're looking at particular cities like San Diego, which is a very expensive city, you can see that actually nearly half of the kids in the US live in low-income families, and those have huge implications for kids, the whole family, of course, but for kids' health and well-being and ability to go on with their life. And just to give more of a sense of the level of precarity that people are living at, in one national survey, nearly 70%, it was 69% of Americans have less than $1,000 in savings. 45% have absolutely no savings. So you think, and this is why it's so easy, why so many people are sort of at the cliff's edge, ready to fall into homelessness, because if you have nothing in savings, or even if you have 800 and your car breaks down and you don't have the money to fix it, your car is the way you get to your job. So then how do you, how can you keep your income coming? Or, and there's all kinds of things that can happen in our lives, as we all know. Most Americans have non-mortgage debt. A third have debt that is in collection, so they're coming after them. And then I already mentioned the rates of homelessness that we see in college students. And so one major source of economic stress is housing costs. When you look at inflation-adjusted rent, it has increased by 2/3 over the course of this. This study was looking from 1960. I can't even see my own thing. I think it was up to 2011, but it has only increased. I mean, especially since the pandemic, of course, it's just skyrocketed. I think that it's been like a 20% increase in San Diego just in the past few years. It's stunning. I know I'm experiencing it myself because I'm a renter also. And you can compare it to, whether people's income levels are going up, and just including everybody, it's only risen 18%. But if you take out the top 20% whose incomes have generally gone up, it's pretty much been flatlined. So for most Americans, 80% of Americans, their real income has really flatlined, while there have been such incredible increases in housing, and also things like, higher education, childcare, healthcare, massively high. So nationally, almost half of the renters are cost burdened. So that means they're spending more than 30% on their housing costs. And I think I mentioned already, something like 11 million renters are spending more than 50%. And I mean, I run into lots of folks who are spending 70%, 80%. Just 90%. They're just that all of their money is going to their rent. And then how do they figure the rest out? Well, it goes to credit cards, this, that. And then San Diego is particularly high. The figure is 56%, according to the National Equity Atlas. So over half of renters in San Diego are cost burdened. And San Diego, we have actually a majority renter city. Across the nation, about 62% of Americans are able to own a home. In San Diego, it's only 48%. the National Low Income Housing Coalition puts out this map. This is actually a couple of years old, so I'll have to, you can go to the site and look it up because it's very interesting, but it basically gives you a sense of how much would you have to earn to be able to just afford a modest 2-bedroom apartment on the open market. And nationally at this point, I think this is actually might be 2018, it was $22 that you needed to make. And of course, the federal minimum wage is like $7.25. It's abominably low. And even the average hourly wage across the country was at this time just under $17. And so obviously the math doesn't work, but the math doesn't work in particular along the West Coast and along the East Coast. I mean, in California, I looked up just this zip code where I live, 92122, and I think it was $56 an hour. And I know almost nobody who makes that. Actually, some of my colleagues may, but they probably don't live here either. So that's the kind of, that's this context, right, of economic insecurity and high housing costs. But there's also this piece about inequality. It isn't just that we're economically insecure. Levels of inequality, and this is some interesting research that's done by Wilkinson and Pickett, and they looked at both comparing countries around the world, and then also looked at states, the United States, because there are differences in levels of inequality across the US states, and found that once you get to a point where, okay, again, peer nations where there's a certain level of wealth, so OECD countries, for example, the ones that you see on the chart there, once you get to a point of having, a certain level of income and wealth, the relationship between that, how much you have, and then other markers of population health and social well-being, it's just all over the place. And what it comes into this line that you see when you start comparing levels of inequality, and they base it on the Gini index. So the distance between what folks at the top have and what people at the bottom have. And the US, it turns out, has a very poor Gini, we have a poor standing in that with the Gini index. And so we're like off the chart when you're looking at levels of inequality. We are so much more unequal than all of our peer nations. And we also have the worst, this is an index, but we have the worst depression, anxiety, incarceration rates, gun violence, various kinds of physical health problems, obesity rates, on and on and on. And then social mobility, which we tend to congratulate ourselves on. We tend to think that, well, in the US, if you work hard, you're going to succeed. We actually have the lowest social mobility rates compared to all of our peer nations. So it matters because it's I guess it's to say that we're all harmed by this, and this creates this context, which I think is I don't know, it enables, it's almost like it's the perfect kind of conditions for harms like homelessness, because the narratives that go along with it, that this othering that we do, the hierarchy of worth, all the ways that we kind of justify all of the inequalities, they work to all of our detriment, I think, and they're just really dehumanizing. So specifically about people, what happens for people when they become unhoused, multiple harms, which then make people even more vulnerable. I mean, sometimes it is health problems that actually send them into homelessness, but the experience itself is incredibly wounding, psychically wounding, but also physically. Lots of ways that they are made to be vulnerable, much less access to any kind of the support services that could help, healthcare, but just housing is healthcare, and so losing housing is profound. The other thing is, people don't just fall into homelessness. They are generally battling for a long time to try not to lose their housing, and they've just they're just pressed and pressed and pressed, and they are exhausted, and they have usually exhausted every possible friend, family, if they've sought social services, and they've tried, so they're really at their bottom, right? So they're coming out, they're under duress. Many, actually, arguably most, also have like a pre-existing condition of a history of trauma, often unresolved, that also puts them at risk. And I'm sure some of you know the data on and the research on ACEs, adverse childhood experiences, which we've known about for about 25 years. And then more recently, some other researchers brought in adverse childhood environments to kind of add in that beyond things that are happening in the immediate home, like physical and sexual abuse, or a parent that is, has a serious mental illness or is incarcerated, or different kinds of things that can happen, that there's also environmental aspects, like living in a community where there's a lot of violence, or experiencing manifestations of racism throughout your life, and overly punitive discipline, and those kinds of things. So when what we know is that when you have all of these things, they put you at risk for just about everything, all kinds of physical health problems, chronic disease. It increases, having higher ACE scores is associated with more inflamed immune system, and it has an impact on risk for homelessness as well. So I think it's that, the more ACEs you have, the higher, obviously, risk that you have for becoming unhoused. And those are childhood, experiences of adversity. When it's sort of flipped and you start with, that was sort of saying, hey, here are ACEs. Let's see how many people among those who have these higher ACEs fall into homelessness. The other way of looking at it is, let's talk with people who are unhoused and ask them about their histories of trauma. And when you do it that way, it is shocking. It is, 80 to 100% of homeless individuals report having experienced life-altering trauma at some point. So trauma is really implicated in so many ways. And particularly among mothers, women. I mean, this is, it's a huge cause, particularly for women. Domestic violence is a major cause of homelessness for them. And so I talked about kind of the structural roots of mass homelessness, but of course there are also proximate causes. What's the very thing that tips people? And so it can be physical or mental health challenges. Oftentimes it is the medical bankruptcy that can arise out of trying to address those problems. So that is certainly a story that is frequent. Substance use or dependency can be a cause, but again, it's about a third of people who are unhoused that are experiencing that. And again, in talking with a lot of people, oftentimes that is more a result of living on the streets. How do I make this livable? How do I keep myself safe? How do I survive the challenges that I have around me? And oftentimes that will involve falling in with people who are doing that. And so it can be both to sort of save you in multiple ways, I guess. Also, I think it's 600,000 people a year are released from our carceral system, many with no place to go, and generally with all kinds of barriers to being able to get jobs, get housing, often cannot even go stay with their families if their families are in states where it is not allowed to have someone with a felony record stay with you if you're receiving any kind of voucher or housing that's subsidized. And so they end up unable to, and so they end up on the streets. Eviction is also another huge problem in our country. Yeah, so just lots of costs and lots of harms to individuals, families, children, communities, and to our society. I mean, I think this is something that diminishes us all, that we tolerate this. And just, I always think it's important, and we try to do this with Homelessness Hub, is rather than studying unhoused people or homelessness, we try to learn with and from people who are unhoused. And so listening to people's words is really powerful. This is from actually a very good website called Invisible People. And this is a quote from one of the people that they've talked with, saying, when you become homeless, you lose so much. You no longer have a place to sleep, store food, cook, and eat. There's nowhere to keep your clothes or go to the bathroom, take a bath or a shower. I mean, that is such a huge issue with people, just dignity, you know, human beings, we want to be able to stay clean. And we're so acutely aware when we feel like other people, we've got this stigmatizing gaze of the public and we don't smell or look or clean. It's really hard. And, you know, all the things you have to leave behind. Often, if you have a pet, I mean, this is, you know, one of the reasons people won't even go into shelters is if they have a pet or they have a partner who's not allowed to come in, or so lots of challenges. So homelessness is really, really hazardous to your health. We have much, much higher morbidity and mortality, at greater risk for infectious and chronic illness, poor mental health, substance abuse, and then also re-traumatization and re-victimization compared to the general population. And again, this is such a counter to the stereotypes that are out there that we all have to be afraid of unhoused people because they're, you know, they're liable to be violent towards us. And the reality is that they are far more likely to be, to have violence done to them, both by, it can be other unhoused people, but also people who are housed. 50% of people in one study by California Policy Lab up at UCLA, they were looking at the ISPDAT records, which is an intake form that looks at the vulnerability of people. It showed that nearly 50% reported being trimorbid, so some kind of chronic disease and or injury plus mental illness plus a substance use, so disorder. And, you know, these are some of the reasons why, first of all, we see shockingly higher rates of things like twice the rate of diabetes among people who are unhoused, but 36 times the rate of hepatitis C, for example, and HIV 20 times. I mean, just the level of risk that people are at out there is so much higher. Apologies for the sound. And, you know, it's about the conditions that people are living in. If they're in shelters, and actually many people choose not to be, sometimes because they are afraid of things like COVID and other kinds of infectious diseases, but if they're in congregate shelters, they're right up against each other, right? Someone's coughing over here, your bunk bed is right there. But then if they're on the streets, then they're exposed to, you know, all this rain we've been having, the cold nights, or it can be heat, right, in the summer. So lots of, and there's sort of in this, I don't know, limbo of just kind of, I remember someone described it to me. He said, it's like, hurry up and wait all the time. You know, you sit around waiting so much, but you also have to rush to where you're going to be able to maybe get the next food, you know, if there's a meal that's being given out, or you need to get over to that shelter if you want to get there and line up and get your spot, or if there's whatever is on offer, you're kind of rushing around and you're just trying to every day figure out, how am I going to survive? Where am I going to stay tonight? What kind of food am I going to get, etc. So that's more morbidity. And then not surprisingly, mortality rates are much, much higher. And then we've actually seen a tremendous surge over the past, well, I think it's actually continued because particularly with overdose. So there's this study looking from 2016 to 2020, and there was a 77% increase in mortality. And I think that it has increased largely because of drugs like fentanyl. So really dangerous drugs that are out there. But every day in the US, 20 people are dying who are unhoused, and many of them are missed. I mean, I think that there are actually, the rates are estimated to be much higher. Mortality rates for people experiencing chronic homelessness, so specifically people who have been out in the streets for, you know, for many years, 4 to 9 times higher than for the general population. And I think this is most jarring. Some the stats that the studies put it at slightly different ages, but in this one from healthcare from the homeless, an average life expectancy of 48 years for someone who is experiencing homelessness. And that's compared to, I think we're at, ours is dropping, the general one, I think we're down to 70, it's either 77 or 78. Children, if you reach back to the stat I was sharing, 37 to 41% of the people experiencing homelessness are in families, so with children, and the number of children out there, again, the stats are varied, but I mean, if you think about the Chapin Hill numbers, 4.2 million unaccompanied youth, And then you think about the implications for their lives, and things like 75% of houseless children drop out of school. It is just so difficult, even though we have the McKinney-Vento Act, where we're trying, attempts to try to keep kids in school and get them to the school that they're originally at, et cetera. It's just so incredibly difficult keeping that going when your family is in constant crisis. Kids who do stay in school fall behind in grade level, and it's just really challenging to try to get back. And it's one of the biggest risk factors for homelessness as an adult is having experienced significant housing instability as a child. And another one is lack of a high school diploma, or a GED is another, it's a top risk factor for experiencing homelessness. So it's just through multiple routes that it really puts kids at risk. And it's arresting to child development also. So lots of linkages between homelessness and health generally, different pathways. So poor health and illness can be a cause of homelessness. Again, people get sick, they may lose their job, they can't afford their medical bills, so they lose their housing. Once people are unhoused, they often come in with pre-existing health problems, but then those become exacerbated and new ones get created. And then when people are unhoused, particularly people living on the street, it is just impossible to heal. And so wounds go on and on and on. I have a friend, he's actually living out of a boat, but it took him over a year for this leg wound to heal, and how difficult it was for him. He doesn't have a car or anything to get to, a doctor. And then, everything is so much more difficult. So, and then, going back to sort of the conditions I was describing of economic precarity and inequality, we really, and if you add in kind of our ecological crises and our climate crisis, I mean, we've got shared roots for these. We know that, think about the climate crisis and our climate weirding and the ways that it's changed. We know that that's the source of new infectious disease agents, coming about. And we also know that when we have the changes that we're seeing across the world of extreme weather and typhoons, and that creates climate refugees. Not to mention, as we are challenged with our resources, it creates human conflict, and that then sends people again as migrants, as climate refugees. And then we also see, I think I already mentioned this, but we, both within homelessness and within infectious disease and all kinds of health problems, we see, our racial and class and fault lines and all of the sort of intersecting, again, the ways our systems of inequity and oppression and our hierarchies of worth, they really play out in all of these ways. So we see disproportionately high numbers of people of color within the broader population of unhoused people. And we also see, with infectious disease and chronic disease, these health disparities. All right, so this is an abrupt shift. That's just sort of this kind of backdrop. And I don't know, hopefully it was helpful or interesting in some way. And I just want to talk a little bit about what we're doing at Homelessness Hub at UC San Diego. UC San Diego, we're all at UC San Diego. I don't know, that's in our title. We launched last July, but actually it was an expansion of a sort of H Hub, which was a data hub for kind of aggregating and making available, geocoded data that had anything to do with housing or homelessness, so that people, researchers in particular, but also policymakers, service providers, anybody, advocates, community members could access it. Because we had found, as researchers were, we would be asking questions and we would say, but where can you find that? So for example, we wanted to know where are all of the affordable housing units across San Diego? And it turned out that was exceptionally difficult to find out. And we ended up getting, a PDF over here and this list over here, and, basically a lot of different sources with incomplete information, tried to bring them together, clean up the data, and then geocode it and put it up so that someone could pull up a map, for example, of affordable housing units across San Diego. And then you want to be able to see, oh, well, where is it relative to transit, right? Public transit and healthcare clinics and basically all those things. And what about green space? And what about all of those kinds of things? So that was the sort of start. But we knew as we were working together, we were starting to see how, I don't know, I guess big the problems were in ways that around homelessness, as around many issues, there's a lot of kind of siloed working and not a lot of collaboration. So we became really interested in trying to create a hub that would be about research, but also policy analysis and education. And building relationships of trust, and then being able to bring people together to have conversations around homelessness and its many roots and intersections. So lots of different intersections. So I mean, as human beings and of course as researchers, but I mean our ultimate aim is to what do we really want to how do we inform and guide and support policies? We can do that through research because we're interested in ending homelessness in our region. And I do think it's possible that we can do that. There are cities that have gotten to functional zero, as they call it. And it doesn't mean that people won't fall in, but that you have really fast turnaround and you can provide services immediately. And I believe it's possible. And so that is our aim. But we also, we want housing justice. I personally feel like housing is a right. I know how critical it is for health and well-being, belonging, citizenship. And so I certainly were invested in, providing decent, dignified, healthy housing for all residents. But again, we're researchers and educators, so we can't build it, but we can be partners in that. But since that's kind of we know how long it takes to build, so that needs to be underway. But meanwhile, there also needs to be ways that we can relieve suffering as we collectively move towards that goal. And so towards that end, we're interested in, helping to evaluate different kinds of interventions so that we can understand what works, what doesn't, how do we upscale what does work. So just in, different kinds of addressing the issue at multiple points, as I said, to addressing people's immediate needs, which I think is often what a lot of the focus is. Like you think about a metaphor of either a stream and thinking upstream and downstream, or you think about a cliff, and a lot of the focus is either downstream or at the bottom of the cliff with the ambulance that's taken people, to somewhere, to the hospital often, because this is another issue, is that we spend a lot of money as a society on, kind of the fallout for people who are so harmed by this, and they end up in ERs, and that's really expensive, and then they are released and then they're back on the streets. And but we also need to be changing public attitudes, and that is something that we try to focus on when we think about education. We do think about students at UCSD, but we also think about public pedagogies and public facing communications and those kinds of things, so that we can debunk some of the kind of myths that are out there, and help people to identify with and kind of to humanize people who are experiencing homelessness, because that then can change what ways people vote, whether or not they, show up to a community meeting and say no in my backyard or yes in my backyard. And we're also interested in trying to build some of what I had said was lacking, which is, more cross communication and collaboration and recognition that, across universities, across service agencies, across city and county entities, there's a lot of great folks, good-hearted, smart. Let's work together rather than, again, being in our little silos. And then, of course, creating more housing options, which is significant. We are challenged because we have a housing system that is in a market and it's profit oriented. So, and we have, as a country, withdrawn from social housing or publicly funded housing. That money for that has shifted to vouchers, but it's difficult to have vouchers. First of all, don't have enough vouchers for everybody who needs it. I think in California, it's something like 1 out of every 5 people who needs a voucher gets it. But even for those who are lucky enough to get a voucher, there is not necessarily a house on the housing market that, where a landlord will take it. And then finally, changing how research is done. really, again, I think I mentioned sort of thinking about how we can work in a collaborative fashion, not just with other university researchers and other folks out in the broader community, but people who are experiencing homelessness themselves. That is something that we think is really important because they bring, frankly, life experience, expertise to it. And so, action-oriented research, participatory, collaborative research, yeah. And always through an equity lens. I don't know if this, so this is the data hub that I had mentioned. I don't think it's all coming up, but we've done a number of things. We developed a field app for the San Diego River Park Foundation so that they could go out, and as they were monitoring trash that can build up in the river, along the river bank, and talking with people. It was actually part of a research project that we were doing that was looking at human fecal contamination along the river. And there was, as is often the case, a presumption that it's unhoused people that are, going to the bathroom right by the river, and then it's going in, and that's why we have the fecal contamination. And so, we created a study which was able to both do some mapping and ask people about their bathrooming, toileting habits. And again, people are doing the best they can with really limited. We do not have very many public restrooms, but the study actually debunked the idea that it was all these unhoused people going to the bathroom, and that there are lots of other causes, overflow of sewage, etc. Oh, sorry, I think this is just, so this is what H-Hub was. And then, so what we're up to now, again, launched in July 1st. We already had some research projects that were going, just because that's what we do. But we're sort of growing that, although I wish we were growing our capacity and our staffing faster, because we are coming out of our ears. I'm just noticing the time, so I might just choose a couple of these to talk about, so that there might be some, time for Q&A, because I'd love to hear from folks. But yeah, lots of different research. I mentioned the safe parking program that I had spoken with people there. We just finished up a 3-year evaluation, looking at that, and what are, how is that as an intervention, and what ways, what lessons can we learn from it? Is it something that could be upscaled? It is a relatively new intervention. And in fact, that's been impactful because it is an important tool in the toolbox, I would say. Obviously, it's not solving homelessness, but as I said, there's all these things that we need to be doing while building more housing that's affordable. And one of them is that, people staying in their cars is one of the fastest growing subgroups of people who are unhoused. And so they've expanded one lot to 24 hours, which was a significant thing that came up for people that we spoke with. And they've also just opened another lot. Yeah, I think I'm just so right. So and the other thing about the safe parking program is that we created a course to go, a 2-quarter course series to go along with it. So we trained students as researchers. And so they went out and did, for the past 3 years, 175 oral history interviews. So it was both really transformative learning. So for them, pedagogically, it was really powerful, but also it was really, a really rich experience, I guess, all around, because the people who were being interviewed, actually having this fresh-faced college student caring about them and being interested. Sometimes research can be an intervention in and of itself, and I think it kind of was powerful. So we were doing a quantitative analysis of HMIS, Homelessness Management Information System data on the side. So this was a mixed methods. So we got the quant, and then the qualitative was the interviews. We did listening sessions with frontline staff. We did listening sessions with clients across the 4 lots. And then we did feedback sessions. So just a lot of back and forth, and learning about people's kind of trajectories and their stories and how they were living their lives right now. Really powerful. Yeah, those are the students. So that was just good. Combine it with other kinds of activities, like going downtown for an ecosystem, sort of a homelessness services ecosystem tour to understand, what do we have that's going on. So yeah, and interacting in very human ways, having meal with folks. So just humanizing it a lot. Oh yeah, and we did a kind of a community of practice, convening other folks that have safe parking programs from mostly on the West Coast. I guess I'll just say one more. So the HEAL Network is this very cool program out of the San Diego Housing Federation, and it stands for Homelessness Experienced Advocacy and Leadership Network. And so these are people who have experienced homelessness and they go through a training. And so we had this last summer kind of a pilot co-researcher project where they, I don't know if people are familiar with the community-based participatory action research model, which is where you are working with people who are impacted by an issue, and you collectively, design the research, come up with the questions, do the interviewing or the data collection, analyze it together, and write up. And so that's what we've done. And we're looking to kind of expand that with a number of different projects. So I think that's it. I'm just going to go through the other ones. Yeah, public convenings. Yeah, so let's just stop there.
Wow. Leslie, thank you so much. Wow. Talk about a sobering topic, right?
Oh, yeah, I know.
Amazing. And I applaud you and your colleagues for working in this area. I mean, just I'm struck myself personally about just the prevalence and the granularity of the issue. I've learned more about it today than I think I was even aware of. So thank you for that. And again, thank you for working in this field. So basically we have an open Q&A. So if anyone has questions, please feel free to speak up, or you can put them in the chat. And as far as you had mentioned early on, as far as these the counts that go on, the homelessness counts, how if I were just personally were interested in something like that, how would I get involved in that?
Oh, yeah, I could probably find it. It won't come around again until February, but they are always looking for volunteers. And yeah, everyone who I've talked with, I mean, it's brutal. You got to get up at like 4 a.m. because they try to do it, really early so that they try to get as accurate a count as possible. But you basically sign up and they give you options for where you want, what area do you live in? Do you want to kind of do this? And it's, you go and you do a brief training, and then you get an app, and you're going to run through a few questions with people so that you can get us, they're asking, I think they ask questions about, do you have any kind of a chronic health problem? Do you, a substance use problem, those kinds of things. And they ask them where they're from, and just a small list. And then everyone who does an interview is given a gift card. I think it's like $25 gift card. So.
And I guess as far as Prepare goes, in our infectious disease context, I mean, how aware are people? Obviously, they know they have daily impacts, cleanliness and hygiene living in a constantly changing location, right? How aware are they of the actual risks maybe that are involved, such as like the hepatitis breakout that we had recently? What would you say?
Yeah, I mean, I think we often think, oh, people just don't know on all topics, right? We're like, we just need to give them education and information. And I think oftentimes people really know. I mean, people were afraid. A lot of the reasons why they really didn't want to go to shelters during COVID was, I don't want to be in a big place with a bunch of other people. I mean, they're aware. They want to be able to wash their hands. They want to be able to go to the bathroom. They really want to be able to shower. I mean, gosh, like I said, this is an issue that comes up with everybody I talk with. So it's structural. It's like we can't get access. There are not places to wash our hands. So it's not about not knowing, it's not being able to access. Yeah.
Yeah. And then, should they get ill, right? Of course, there's no infrastructure really. So they do, if they end up in the ER, most likely. So like you said, it's a greater social cost that way too. So we just need to be more proactive about so many areas, especially unhoused people. So
yeah, there are estimates of like, I mean, they range quite a bit, but estimates that it's from $35,000 to $60,000 on average per person living on the streets in terms of how much of like the society is the cost to society in terms of ER visits, police, social services, just everything, right? Cleaning, all of it. And so when you do these calculations, we actually spend more not solving homelessness than we would if we, it is not wise. And it's also inhumane.
You had also mentioned there are locales, I assume in the States or North America, that have gotten to the near zero. What methods are they using that we could learn from here in San Diego?
Yeah, there are a few, and it's only in certain areas. It's not like solve it completely. It's like, hey, we've got veterans under control, or maybe youth.
Mhm.
You know, oftentimes they'll start with one that it's, I don't know, more appealing to the public. There is a national organization called Built for Zero, and actually San Diego County and City were connected to it. And the whole idea is we need to be shifting away from, like, a point in time count is helpful, but it really gives you a snapshot one time in the year. And we
Right.
need to have data that's coming in constantly. We're
Mhm.
starting to get better at it, because you need to know what is your particular, what is the profile in your particular city, because it really is different. And the population is so incredibly diverse by age, race, ethnicity, you know, sexual orientation, background experience, occupation. I mean, I met people who were living in their cars, who had college degrees. In fact, I brought a woman in for a panel, and she was living in the canyon, and she had been a school teacher. I mean, it's just like my students, their mouths drop open repeatedly, because you just keep being shocked. And I think one of the biggest lessons is, wow, this really could happen to anybody.
Right.
So then, to, you know, what do we do about it? It's the cities that have managed to fix it for the one group, they put a
Mhm.
lot of their attention. They're also smaller cities, I will admit. You know, it is, and we're like number 4 or 5, we toggle in terms of the worst case. In San Diego, it is so hard because of our housing situation. Until we,
Mhm.
you know, push past a lot of our zoning laws and our sort of our resistance to infill and having more dense, you know, construction and having housing that's affordable to people, we're not going to be able to solve it. And, you know, because I think that we could, on the other end, you know, we could, you know, being able to get people, you just need an end place to get them. And that is the biggest challenge, seems like.
Joel has his hand up. Joel, do you have a question?
It's a little disconcerting to me. I mean, I accept the fact that most public policy decisions are made on inadequate data. And what's most disconcerting to me is that very early in your talk, you presented 3 different estimates of the level of homelessness in San Diego from 3 different sources.
Mm-hmm.
And that does not give you any confidence, or give me any confidence, that you actually can measure the outcome of anything you institute. So it seems to me you have to figure out what's responsible for the variation in determining your denominator
Mm-hmm.
before you can ever begin to assess how well you're doing. So as a data hub, it seems to me that should be, or is, one of your goals. So my question is, how do you achieve that? And how do you measure your success?
Well, so the data hub is a piece of it. I mean, right now we're not trying to be the group that knows exactly how many people are unhoused in San Diego. What I was showing in that slide was the fact that this is a problem around the country. So I was saying that 2 different organizations were reporting the number of unique individuals that were coming to their organization. So it was 16K for interfaith, it was 27K for family health centers. So that's to say, okay, they have this many people. Point in time count, everybody knows it's not you know, accurate, but it is at least a thing that you can say every single year we're doing it at this time. And so it can give you a sense of, is it going up, is it going down? And that's what it does. Right. There's a regional task force on homelessness, which, and it is their actually job to be able to figure out how many people are unhoused. And but they face the same challenge, right? How do you measure such a thing when people are, you know, hiding in the interstices? They, you know, some are out there, and you can count that. In fact, the downtown partnership does count every month the number of people who are in the downtown kind of like east, you know, the East Village area. So they do count that, and that's getting better. So if you're doing something every month, that's better than once a year. But again, that's only this one area. You need we would need a whole fleet of people, and I mean, it is difficult. So, you know, what can we do? How do we measure our own success? I mean, we we undertake different research projects, and of course, embedded in those are, are we coming up with data that we can live by, that are our peer reviewed, journals, accept as accurate, and all of those kinds of things. And then for us also, is it actionable? Is not just, is this accurate data, and I'm confident that the data we get from our research is accurate, but also something good coming of it. It is not just a what, but there's a so what to it. But yeah, I could completely agree that it is a problem that we don't have a full sense, and it's something that as a city and a county.
Has there been any attempt to utilize homeless people themselves as data gatherers in the context of seeing what these numbers are really represent?
Nothing systematic. I mean, there are attempts. I think some service organizations, for example, will hire people to do some of that bridge work, trust bridge work, and also to work as service providers. And we're working to collaborate with people with lived experience as researchers, because I agree with you. That's another way that you can get access to to people. You need a sort of a trust bridge, because there's a lot of reasons why people don't want to talk to you. So yeah. No, not enough, I guess is the answer.
So Leslie, it's 2:02. I don't know if you have a couple more minutes. We had one last question. If not, okay,
no problem.
Let's quickly hit that. So this is from our Prepare colleague Jean Tan. So we just want to know how San Diego compares, say, to other cities like New York or Chicago in terms of how they address the homeless, housing for the homeless.
Chicago and New York City. I mean, New York City, in terms of the problem, I guess that, New York is a huge problem, although they have a right to shelter, which we don't have, which you can think about really, I mean, I was going to say you really need it because it's so much colder there, but it gets pretty cold here. So it's pretty awful that we don't have a right to shelter. I would like a right to housing.
What does that mean, the right to shelter?
So a right to shelter means that somebody can show up and they have to get them into some kind of a literal shelter, some kind of an emergency shelter. It's not the greatest, but it is out of the elements, right? Whereas here, the reason we have so many people on the streets is that, we do not have the capacity to get them into shelters. And, you will hear, and it's true that some people will deny shelter. They'll say, no, I don't want to go there. But there are lots of reasons why they don't want to go there. Actually, one of the things that we're going to try to do is to get funding to do an evaluation of our emergency shelter network, to try to understand what is going on, what is the full scope of what's out there, and why, and what, to what extent does the capacity not meet the need, and then to what extent are there lots of folks who just don't want to go, and why don't they want to go, and how might you be able to change that so that, you get people the support and services they need so that they can, get into permanent housing.
I see. Because I'm trying to figure, because I'm from the East Coast, and I was in New York City, and we do have a lot of homeless people there, but they're not as visible that they are here. And I'm just trying to figure out, is it a numbers game? Is it because here it's the weather is more temperate than in city? Where do New York City hide these homeless people if there's equal amounts of per population, right? Where do they go? So
yeah. So there are two issues. One is the numbers, and the other is rates. So you can look at a city like San Diego and actually New York. So they both have high numbers, but I actually think New York. Trying to think, I can't remember offhand whether they have a higher rate. Los Angeles and New York are the highest, I think, in numbers as far as cities. Seattle's right up there, and we're either 4 or 5. We toggle, but it's that right to shelter, which is probably why it's not quite as visible. But we also have, it is huge numbers that we have in San Diego, and I think it's very much a function of a housing system, and this disparity between what people earn and the housing costs. I mean, I had heard a few months back a stat which shocked even me, because it said that we were actually less affordable than even San Francisco. So San Francisco, no doubt the housing costs even more, but also their average wage is higher. And so the fact that we don't have a wage that is equivalent to, especially what we've seen in the past few years, where our rental prices have gone up, 20%.
Right.
Yeah.
It's very interesting. Thank you for the
Yeah.
talk.
Yeah. Sobering, like you said. Yeah. Oh, I think you're muted, Steele.
Thank you, Leslie. Thank you for the heads up. So I'm going to just briefly share who our next speakers are coming up in April. So we're going to have Dr. Laura Crotty-Alexander and Dr. Jorge Massimo Silva. They'll be speaking about functional neutrophil studies in the context of acute respiratory distress syndrome and COVID-19. So we're still working on the scheduling for that, but as soon as we have that, we will get those announcements out to you so you can all attend. But thank you all for coming today. Leslie, it's a pleasure hearing from you. I look forward to working with you very closely, especially on issues related to equity and community resilience. So really incredibly grateful for your time today and making us more aware of the degree and the importance to address this issue in the most conscientious and thoughtful way possible. So thank you so much.
Oh, thank you. What a lovely thing to say. Thank you all very much. Yeah.
Have a great day, and we'll be posting this up on our YouTube channel shortly. So have a lovely weekend, and great day, everyone, and take care. Bye-bye.
Bye.